So your surgeon just cleared you to start to move your arm again after a rotator cuff surgery. But now you're thinking, how do I do that without messing everything up? Well, I'm Dr. Dominic Rangel. I'm a physical therapist in San Antonio, Texas. And in today's video, I'm going to walk you through the exact way to start active range of motion safely after a rotator cuff repair. First off, let's define some things. Active range of motion means you're now in control. You're moving your arm without assistance from someone else. Usually we start that around week 6 to 10, depending on your specific surgical protocol. This is a major step. We're moving from passive or active assistive to functional movement. But why is that so important? Well, early active range of motion is going to help to rebuild your coordination and your control. If you start it too early or you start doing it incorrectly, it can overload the repair and cause poor movement patterns, or worse, even just a re-tear. The goal early on is to restore smooth movement without compensation. The biggest compensation we see is a shoulder height. Here are the top 3 active range of motion exercises that I start after a rotator cuff repair whenever people can actually start to move their arm. The first one is wall slides. You're standing at a wall, you're facing the wall, you're going to use a towel, and you're going to slide your arm up the wall as far as comfortable. Most patients are starting at somewhere around 90 degrees, and we're slowly bumping that up to get it all the way up over their head. You're going to focus on keeping your shoulder down and relaxed, and we don't want to work through a shrug. That just means you have a motor control deficit. Number 2, you're going to work on side lying external rotation. So what we're going to do is we're going to lay on your side, not your surgical side, the opposite side. You're going to keep your elbow tucked in at your side. You're going to rotate your forearm outward, basically up towards the ceiling in that position, in a slow, controlled motion. This is a great way to activate your rotator cuff on the back side of your shoulder without stressing the joint out too much. Third exercise is going to be side lying shoulder abduction. So you're going to lay down on your side again. You should already be there if you did side lying external rotation. While you're keeping your elbow straight, you're going to focus on form and control, not the height of your arm. You're going to take your arm and you're going to raise it up to your side. I call it the big goofy wave. This is going to build activation in your top part of your arm, basically your deltoids, which is the muscle that you see on the side of your arm, and also your supraspinatus, which is the most commonly torn rotator cuff. Okay, so how do we track the progress? We monitor range of motion with something called a goniometer. It tells us how many degrees of motion that you're gaining and how many degrees of motion that you're able to attain. We track shoulder strength over time using a handheld dynamometer, but we usually don't start that till around week 16. Because that's whenever it's safe to really test your strength and have you push as hard as you can. These tools are going to help us stay objective and make sure that you're actually progressing and we're not just, right? But if you're doing all of this and you still feel stiff or you're hesitant because you're not sure that you're doing it correctly, some discomfort is expected, right? But sharp pain or a plateau definitely needs attention from somebody that knows what they're doing. That's where guided therapy and hands-on care comes in. If you want a personalized recovery plan, I work with patients after a rotator cuff surgery literally every week. Like, let's make sure your recovery is efficient, personalized, and gets you back to what you love. Ways to contact me are going to be found in the description below.